Welcome. My name is Dr. Suzanne LeBlang, and I'd like to talk to you about this exciting new technology called Curawave. It's a completely non-invasive way to treat the symptoms of your uterine fibroids. There are no incisions, and you can go back to your activities of daily life the next day. So the Curawave procedure involves MR-guided focused ultrasound technology, and I'll tell you about this. I'm going to explain to you the Curawave procedure itself and how there's very little patient preparation, what happens during the procedure, and how quickly you get discharged after the procedure. I'd also like to talk to you a little bit about the data that's been published in the literature about the Curawave technology. So the Curawave involves MR-guided focused ultrasound. What is that? It involves two things. It involves an MRI machine and an ultrasound machine. An MRI machine, you may have heard of, is the best way we have at looking at anatomy. So we can see your fibroids, we can see your uterus, we can see exactly where they're located in your pelvis. Some of you may not know that the MRI machine can also be used as a thermometer. And this is going to be very important because we want to heat the tissue in your fibroid to kill it. So we need to know that it reaches a certain temperature. So the MRI portion involves seeing the anatomy well and following the temperature changes, and the ultrasound part of the technology involves in actually heating up the tissue. So it's very interesting because most of us have had an ultrasound either during our pregnancies or for a gallbladder disease. It's a very easy way of looking at anatomy as well. But this time we use the ultrasound beam to generate heat. And we can make the ultrasound beam converge at a focal spot inside your fibroid and heat it up. So, why do we want to heat it up? Because heat can kill tissue. If we reach 57 degrees Celsius for 1 second, we can kill all the tissue in that region. But the MRI machine is not a perfect thermometer. There's nothing inside you. So we like to reach at least 60 to 65 degrees Celsius just to make sure. You've probably heard of other things that are using heat to kill tissue. RF ablation or lasers are commonly used in medicine to kill tissue. And some of you may also recur a brother or a family member taking a magnifying glass out in the sun and making the sun's rays converge at a focal spot on the leaf to make it catch on fire. And it's a very similar principle with the focused ultrasound beam. Inside the focal spot, inside the area that we're actually heating up, we can generate super high temperatures. And 1 millimeter outside that focal spot, the temperature is baseline and normal. So any tissue outside that focal spot is not heated up and is left completely intact. The day of your Curawave procedure, you lie face down on the Curawave table. The ultrasound beam comes in from the table, and we use the anatomic pictures from the MRI scan to guide that beam directly into the fibroid. For 20 seconds at a time, we heat up each area, and spot by spot, we go and kill the tissue in that fibroid, and the surrounding uterine tissue is left completely intact. Here's a picture of the focal spots, which are put over the anatomic pictures inside the fibroid, and those focal spots, those round circles, are the areas we're going to heat up one at a time. We then put the beam path, shown in green here, over the anatomic pictures so we know we're guiding this beam safely into the fibroid. We have to make sure we avoid any clips or scars or air bubbles that could possibly deflect the beam. And again, we use these anatomic pictures to do this extremely safely. On the other computer, we see the thermal images or the temperature images. So as the fibroid is heating up, we can see it changing color. If it reaches the threshold temperature of 60 to 65 degrees Celsius, it turns green. It then gives us this graph. If it reaches 100 degrees Celsius, it's too hot. We can turn the energy down. If it's 57.8 degrees, it's not quite 60, so we have to turn the energy up to ensure that there's killing of the tissue. We talk about a non-perfused volume because we want to kill as much tissue as possible inside this fibroid. So here we see the before and after pictures. Before the Curawave procedure, the round fibroid has a blood supply, just like the normal uterine tissue. But after the Curawave procedure, the fibroid is almost completely dead and shown here in black, but the normal surrounding uterine tissue is left completely intact. So we try to achieve 100% non-perfused volume or 100% kill in every procedure, but we can actually calculate this percentage at the end of every procedure. The day of the procedure, you come about 1 hour early to fill out paperwork at the front desk. We put you in a prep room. We put an IV catheter in your arm so we can give you some medicine during the procedure and some fluids. And we put a catheter in your bladder to make sure that you don't have to get off the table to go to the bathroom during the procedure. We then put you face down on the Curawave table and get those beautiful anatomic images to help us plan the procedure. So what happens after we kill all this tissue? So you see here the before and the after picture. Before, there's blood flow to the fibroid. After, it's almost completely dead. Well, patients improve for 2 reasons. Number 1, we defunctionalize the fibroid right away. So when the fibroid doesn't have a blood supply anymore, it doesn't cause any reaction during the menstrual cycle anymore, it doesn't respond to all the normal hormones. It's like taking a grapefruit and scooping out the pulp right away. And then over time, all this dead material will get reabsorbed by the body and it will shrink over time as shown here. So patients get better for 2 reasons. There's defunctionalization, so we're killing the fibroid right away, and number 2, it shrinks over time. Within 1 hour after the procedure, you're discharged. In fact, even before you get off the Curawave table, we take out the IV catheter and the Foley catheter. You go into the changing room and get back into your normal clothes. You can use the bathroom on your own, and then you're given a list of simple discharge instructions, and then you can go on your way. There's been a lot of reported data in the literature about the efficacy and the ability of Curawave to improve your symptoms. In this chart, it shows the decrease in the patient's symptom severity score, or the level of their symptoms from the fibroids, and how it improves maximally in the first 3 months after the Curawave procedure. And then that symptomatic improvement is now durable over the next 2 or 3 years. It makes sense that the more tissue we kill, the better you'll feel. So the higher the non-perfused volume, or the more tissue we kill, will result in a greater success rate. Also, the higher the non-perfused volume, or the more tissue we kill, will make you so much better that the probability of an alternative treatment is minimized. Whether you have mild, moderate, or severe symptoms, everyone has been shown to benefit from the Curawave procedure. So the most important thing about this technology is that it's completely non-invasive, and it's an image-guided procedure, so we can see what we're doing, we can monitor the temperature, all without making any incisions in your body. There's no hospitalization, no anesthesia, no radiation, and you can return to your normal activities the next day. There's also an extremely low rate of complications, and out of the 13,000 procedures that have been performed worldwide to date, there's only been a handful or less of complications such as skin burns, bowel injury, back pain or sciatica, and endometritis. So I hope you've enjoyed this presentation on this exciting non-invasive procedure that can decrease the symptoms from your uterine fibroids.